Sister Lillian Remedies, because a mother needs to be sure.
We're back at the Sister Lillian Centre in Linwood Ridge, Pretoria, with one of South Africa's leading pregnancy and parenting advisors, Sister Lillian Paramore, for responsible, practical advice.
Today we're going to talk about common health problems in little ones, from when they're very small and they might have colic and reflux, and then as they grow a little bit bigger, a lot of problems with excess mucus, and that can translate into ear problems, earache, and maybe sore throats, even possibly tonsillitis. Mom has to be Dr. Mom in the home, and with me today are a group of moms who've got maybe similar problems. Anyone heard something that tickled their fancy?
We've got the reflux here.
Oh, yes. You know, often babies have that and they'll retain a sensitive tummy all the way up to about a year. That doesn't mean one can't do anything about it, but you must just know that often it's in the family, slightly weaker digestive system. And it's often after a baby's been born by cesarean section and possibly had some procedures as well. Formula babies are more prone than breast babies as well, but one of the things that really helps is to feed them smaller amounts more frequently. And I'm sure you've discovered keeping a baby upright after a meal, otherwise it just all comes back. There's also a very helpful homeopathic remedy, I don't know if you've ever seen this, for reflux, called nausea care. It will never take away the problem altogether, because it's not something that's going to stop it, because that would give adverse reactions.
Reading babies' needs and responding in a way that satisfies the child gives mothers the feeling that they're genuinely connecting to their baby. Health niggles can hamper this process.
And I suppose with a baby of 11 days, you're wondering if that's coming your way soon. So which one are you more concerned about, colic or reflux?
I think definitely the colic.
And why?
Because of the constant crying.
Yes, that can erode away at any mother's confidence. Remember, about 75% of colic is about an anxious mother. A baby reflects what's going on in a mum. So a laid-back, relaxed mum, laid-back, relaxed baby. So, you know, that's really the key to it. But, of course, sometimes with a lot of crying, there are symptoms in the tummy, in the digestive tract, and that's what we call colic. Sometimes that constant crying really does have physical symptoms with it, and it's not that colic doesn't have real symptoms. If a baby's hiccuping a lot, pulling up those little legs, going like that, and really looks like they're in pain at feed times, well, sometimes there is colic. And so if your baby has physical symptoms of colic, there is a very safe and lovely homeopathic remedy called colic care. I mean, the name says what it's for. You simply give her one of these a few times a day.
The gentle touch of homeopathic remedies can smooth baby's symptoms. Choose a trusted brand like Sister Lillian Remedies with the help of your health practitioner.
As little ones get older, there's also another very common problem, and that is sore throats, sometimes even tonsillitis. Does anybody's little one suffer from that here?
Yes, my child is suffering from the sore throat and he's got a lot of mucus.
And that's probably what causes the sore throat, because it runs down the back of his throat. Now, there's a number of things you can do about that. I always believe in first treating the cause, and that means he must eat healthy. If you eat healthy, you are healthy. But if it carries on, and especially if you find the doctor saying, we think we must take the tonsils out, well, first try Tonsi Care. The name tells you what it's for, and it's actually all sore throats as well as tonsillitis. But start off with getting rid of the mucus, and for that, there's MucoCare. And I've heard that there's a mom amongst us whose little one has ear problems, you know, ear infections, glue ear, earache. That's very common in children as well.
Teething can mimic an ear infection quite closely, except for a few distinct differences. Teething symptoms are milder, while ear infections are recognized by high temperatures and discomfort.
It's very important to be able to recognize when a little one has got sore ears, because it can become a bad infection and that must be treated. Often they cry in a voice that's a lot higher than normal, and usually they're also quite hot. If you feel them, there's a bit of a fever. And if they're lying down sleeping, it's a lot more sore. The moment they start with sore ears, you can start with a safe homeopathic remedy like ear care.
Moms, trust your instinct and you'll do fine. Benefit from Sister Lillian's wealth of knowledge and years of experience by visiting sisterlillian.co.za.
The important thing to know is that the healthier you live, the less problems there will be. And never forget, it is both our right, but also our responsibility to take care of our children's health.
Sister Lillian Remedies, because a mother needs to be sure.